So in this slide, I'm trying to explain the reasons why I use threads. The first and the most important thing maybe, I can undo the threads and I can redo the threads. Another reason that I use threads is just 5-6 years ago, I also refused the patients who asked me to treat them with threads. And I tried to convince them that the surgery is better, blah, blah, blah. But at the end, I could not operate them. Instead, they found some other doctors who can treat them with threads. And last but not the least, if the patient asks for surgery instead of thread lift, I of course do the surgery. And you know what? Facelift surgery is cheaper in my hand than the thread lift. Why is that? Because I know that I will have a similar result with less risk of complication. But they usually choose the thread. The most important reason for me to choose the threads instead of facelift, the most important thing, increase the number of my surgical facelifts, because patients keep coming because I'm doing threads. And sometimes they are good indications, sometimes they are not. If they are not, I offer them a facelift surgery. Okay, this is the first patient that I want to share with you. She's a lucky patient because Dr. Konstantinstan has operated her with threads in mid-face area, and she's very happy with the result. And she's a special one because I operated this patient together with Dr. Jean-Paul and Thierry Bezan in my clinic just before Corona outbreak. I chose especially this patient because this is a very difficult neck to treat. It had been more than 2 months now, and patient sent me the picture today. Now it's, as I told you, it's nearly 10 weeks. Please look at the lifted mandible angle, which makes a better lower face, and her jawline and neck at the lateral view. And when she makes her chin down, the lower face over the mandible lifted perpendicular to the cheek, which contributed a better neck and jawline. This is the first patient I tried thread and lift for the first time. This was the first patient. Had the result of this patient ended up bad, I would not use thread and lift, because until that time I was using spring thread. And let's see my planning in this patient. The first patient, liposuction in submental area, one thread for the neck. This thread should pass relatively superficial compared to the ones that we use for the mid-facelift. The threads from the two sides of the neck should exit from the same step incision. I will make it clear later. And they should interlock each other. Another thread which comes relatively perpendicular and passes the border of the mandible and goes into the neck. This also helps for the neck lift. And 2 more threads for the face. early result 3 days after the surgery, and late result. This is maybe 8 months after the surgery. So, what will you learn in the seminar? You will learn how to use threads in the neck area. The difference between the neck and the face in terms of inserting threads, the importance of the contour of the mandible. When we are talking about the neck, we should also talk about the mandible. And the importance of the injections, filler or hyaluronic acid injection, fat injection, whatever. This is also very important in the neck rejuvenation. So let's start with a short video. This patient had been operated before by myself with threads. And she's a little bit unhappy with the submental area. There's a small skin sagging in submental area. So this Monday, 4 days ago, I operated her in my clinic. As you can see, the exit point is a little bit superior because I operated her, I corrected her neck before. This is something different, but the idea, the main idea is the same. Now, as you can see, I interlocked thread from one side, and then I'm inserting the other end of the thread with the other side. Now, this time we just try to correct this area because the neck was corrected before actually, and here these are the other parts of the thread for the suspension. It is in front of the ear. This can change. It can be this thread can go beyond the ear or in front of the ear, depends on the patient. Now this time I want it a little bit in this direction. Now, can you see the border of the mandible angle and the border of the mandible? And please take a look at that. Threads are inserted very superficial in the neck area. And after I finish the neck, I'm cutting the threads. Now, this is not today's topic, the other maneuver, this one. Not today's topic, but it's good to see how I do, because I will tell it, I will bichectomy loop with threads a lot of times. So I want to show you how I do that. It's also, there are different techniques. This is one of the techniques and I like it. Now, the thread is deeper. Why do we need bichectomy loop? It's actually not a bichectomy loop, but the chubby face, chubby cheek can be lifted up in order to create a nice zygomatic bone. So the thread now is deeper, and I'm doing a loop with the thread. This nice gadget is a present from a good friend. She is also a very good practitioner who uses threads. Temporal fixation of the threads sometimes, but I use it for this reason as well. And this is some releasing maneuver. And from the same step incision, I'm putting the thread, and after I lift the cheek, I cut the ends. Now, this is the same day, Monday. before and after photos of the patient. Left cheek, just like something like a bichectomy look, better mandible contour, immediately after. And this is immediately after. Now, this is the result of the patient in this video 4 days after the surgery. I mean, today. She came back to my clinic today, and I took the photos.
Dr. Celik, if I may interrupt
5 years ago.
We will. I think
yes.
for most of us, the video was not full. It was very slow. So it's just to say we'll send out the video to the participants, so you'll be able to review it.
Yeah, of course.
That's it. Sorry. Please go on.
Please go on. Review it at the moment or later?
Sorry, no, later. At the end of the webinar, I'll send it out so people can have a look at it again.
Okay.
Yeah.
Okay. This is that patient in the video patient, fourth day after the surgery. I have taken these photos today. You can see 5 years ago in the left photo, and this is today after 2 thread treatments.
Nati, you have absolutely no scar. Thierry speaking. You have no facelift scar.
Yeah, no facelift scar.
Okay.
Because I didn't do facelift for this patient. It is only threads.
Okay, that's very important to say.
From the oblique view, you can see a better mandible contour, and here a bichectomy look after the threads, elevated cheeks. This is the lateral view of the patient, the other oblique view, and correction of the jowls. And please note that this is the comparison of the patient 5 years ago and now. So let me show you the insertion of the threads in the neck area more clearly. It's better than the video, actually. That's easy. First, I do liposuction or skin undermining. Even if there's no fat needs to be aspirated, I undermine the skin with liposuction cannula, small liposuction cannula. I use tonard cannula. This is important. The skin should glide with the threads, and new collagen formation in the dissected area will help in long term. 3 stab incisions. Midline is in the deepest point of the cervicomental contour. You should find this point in the lateral view when the patient makes a chin down movement. The other 2 incisions are usually just inferior to the mandible angle. And 1 thread comes and exits in the midline. Same thing for the second thread. And the first one turns around the second thread, like this. And it goes inside through the exit point in the midline. And same applies to the second thread. And here is your interlocked threads. Now, you can place the other part of the thread in your choice of direction. I try it. Terry and Jean-Paul saw me how I decide. I move the thread in one side or the other. And of course, it depends on the patient. It is sometimes in front of the ear, especially if I want to lift the mandible angle. Or it can go behind the ear to the occipital area. I especially do that to spread the neck skin. And it's better to use the mid-face threads. for the treatment of the neck as well. So as you can see here, the mid-face thread goes beyond the mandible border. Sorry, goes beyond the mandible border, another one here, and they go into the neck. So they will help to lift the mandible border, and they will also help the neck. Now, this is my first patient who asked for only neck lift, no mid-face lift, no nothing at all. This is
wait, somebody.
This has been done. Okay, now somebody started to share
the screen.
Screen, so I cannot share.
Yes, I'm looking to find who it is. Maybe you can override it if you reshare again. You might be fine.
Okay. Ekranınıza göstermeyi devam ettirmek istiyor musunuz? Yes. Actually, I'm sharing my screen now, but somebody else also doing that.
I can't find
sharing.
So if somebody's sharing their screen, you mind switching it off if you find how to do it. Can't you reach?
You can, Dr. Celik, you can click on presenting now at the bottom right on your screen, so you can override and do your own presentation. You can take the lead once again on the presenting space. Just click on present now at the bottom on the right.
I think he logged out. De toute façon, je crois qu'il s'est déconnecté pour se reconnecter. Ah non.
Now I have to, unfortunately, in the problem, I have to exit and come back.
Okay.
Okay. Now can you see that?
Yes, it's coming back. Yes, we have it again.
Okay, thank you.
Okay.
Okay.
Seems to work again.
This is one of the earliest patients who asks for only the neck lift. And this is not with thread and lift. It's maybe 4 years ago. It's with spring thread. And she asked only for the correction of the sagging skin in the submental area, but nothing else. I just did a small amount of skin dissection, and the first thread interlocks with the other thread, and they cervicomandible mantle contour, and thread passes behind the ear. This is immediately after, and this is 3 years after. And this patient and similar neck lift patients taught me the importance of the skin dissection with or without liposuction, and the importance of the threads that we use for the lower face and mid face lifts. We have to use them, we have to include them for the neck lift. How can we do that? We can pass the mandible border when we are using that threads. They can be a little bit perpendicular, which is better for the neck lifting, but we have to pass the mandible border. And I learned that if there's fat, we have to aspirate it and use it. It's a free filler. And we can use this filler. Maybe you can mix it with hyaluronic acid. It's not important. We can use this filler to recontour the mandible. That's very important for the neck lifting. This is the result of the patient. Another unhappy patient with her neck, and she wants something very simple. That's under local anesthesia, submental liposuction, fat injection to the mandible border, one thread, another thread, and this is immediate result. This is 6 months result, and this is 4 years result of this patient. This is a good example to show you how the correction of the lower face corrects the neck as well. We cannot think the lower neck, the neck without thinking about the lower face. This part needs augmentation. And lower face needs to be lifted. And so we do hyaluronic acid injection here and there. And these are the step incisions for the threads. 4 step incisions in the temporal area. First thread comes for the mid-face lifts for the bichectomy look-like effect. Second thread comes for the correction of marionette, passes the marionette, and again, it also helps the mid-face lift. Third thread for the lower face, and it passes the mandible border, just like the fourth thread. It also passes the mandible border. And this is 3 days after, and this is 4 months after the operation. So let's take a closer look to this patient. Augmentation of the zit. This is bichectomy look. C'est clear avec the fil, just with the thread. Marionette line should be pulled more lateral than superior. And jaw should be pulled a little bit superior, not lateral. And this thread should pass the mandible border. It helps the neck. The correction of the neck can be seen in the slide, either with some shadows and without shadows. Neck seems lifted because we corrected the mandible contour. Another patient who hates her neck when she makes her chin down. I can see the problem. And this is her result. Just similar operation, 6 months after the operation. And another patient to show you the importance of the mandible contour when we are talking about the neck. She wants a better defined mandible, better definition of the neck. The first stage is to put some hyaluronic acid injection posterior to the angle of the mandible to make the mandible a little bit elongated. Temporal incision, one thread with V technique, another one which goes beyond the mandible. And I fixed these threads to the deep temporal fascia. You can use PDS, you can use Prolene, whatever. One thread for the neck, and there are 2 threads which interlock each other, as I showed you before. And this is her result from lateral view and anterior view. Another patient, similar type of operation. She's young, she's 38 years old, but she looks older than she has to be. And this is her result 3 months after the surgery. She is also an education patient. Oblique view of this patient and lateral view. Please look at the new mandible contour and the cervical area. And cheek is not, the cheek and the cervical area is not at the same level. There's a definition of the mandible. It's a cervical mandible, cervical mantle contour. This is also a live surgery patient. I've operated this patient more than 2 years ago in a congress. It was a very fast operation, maybe 20 minutes or something. 2 pairs of threads, one for the cervical mantle contour and one for the mandible. And especially look at the picture when she makes her chin down. And this is 2 years later. She is still satisfied with the result and asks rejuvenation of the face with the threads. And this time, it's not a live surgery patient. She comes, she pays, and she gets the operation. And let's see my planning.
Dr. Celik, your microphone was off.
Yeah, somebody shut my microphone. Gökhan Efe shut my microphone. So is that okay now? Can you hear me?
We can hear you.
Can you hear me?
Yes, we can.
Tristan?
Yes, I can hear you.
Oh, okay, great. Okay. I did hearing injection to tear throw.
Maybe if you try to switch off your...
Again, temporal incision.
Maybe if you try to switch off your camera, we'll have a better connection. I don't know if you can try. Yeah, your camera. We might have
switch off my camera.
a better connection.
Okay. Okay. Now you don't see me, right?
I don't see you, but I think I hear you a bit better. If it's okay for you.
Better. Okay, great.
Yeah.
No,
We'll
no problem for me. No problem for me.
Okay, great. Thank you.
Now, hyaluronic acid injection for the cheek and tear throw. 1 step incision at the temporal area, temporal incision, not step incision, 2 centimeters incision. First thread for the midface, and again for the bichectomy look. Second thread for the lower face and maybe for a little bit correction of the neck. Again, V technique. And this is the result of the patient 2 months after the operation, oblique view. Before and after. Before and after, good mandible contour, a nice bichectomy look, elevated cheek. You cannot augment the cheek with just 1 cc of hyaluronic acid. The thread helps a lot for me to for the augmentation of the cheek. And the left oblique. Now, this is also not today's topic because it's a combination of skin excision and the threads, which I call easy facelift. It's sometimes needed, especially in young patients like this, because in this patient, skin is so soft, and when I pull with the threads, there's a skin excess in front of the ear. So this skin needs to be resected. I just want to show you just 1 patient like this. First, liposuction as usual, and temporal incision. I put one thread and another thread. And then I see preauricular skin excess. I do a limited section in this area, and I'm trying to be careful not to cut the threads as they are not cheap. But to tell you the truth, after I cut it once or twice, nowadays I do the dissection first and place the threads after the dissection. That's not important. Then I excise the skin, preauricular skin, and I insert another thread for the neck. And this is the usage of the threads during a limited facelift in a young patient. You can see a small amount of hypertrophic scar just below the ear. We usually don't see that, but sometimes it happens. It's not a big problem for the patient because the contour of the neck and face is much better. And this is also another patient who received endoscopic facelift 4 years ago. And she's not happy with the result of her neck because with endoscopic facelift, it's mid facelift. It's the lift of the face, not the neck usually. So I did this operation. She wants a better neck. Let's see the planning here. This is immediately after. First, liposuction. Temporal incision again. One thread with V technique. Another thread for the lower face and mandible border. I fix the threads, and then one more thread for the neck area. This is pre, immediately post, 3 days after the surgery, and 5 months after the surgery. A good result. She's a happy patient now. She had facelift before. Now she has also a good neck lift with threads. And what about difficult patients? What's a difficult patient? These patients are usually young patients. They don't need a lot of things, but they want a lot of things. And if you do everything, okay, everything good, they like the result. But no matter how good you do that, they will definitely ask something more later. And this one, before and after. Let's analyze her result. Fat injection here. Skin-only blepharoplasty, upper blepharoplasty. Lifting of the eyebrow with thread. Normally, you don't do that, but this patient wants it, and that's okay. It's her desire. At least I'm not cutting her temple. I'm not excising some skin, and I can undo this operation if she's not happy. So I lift the eyebrow with thread, and I do the Canthopexy thread. This time it's different. It's also not the topic of this talk, but it's the Canthopexy part with thread. And bichectomy look and augmentation of the cheek with the thread. Now, this is before and after the result, and the result from the frontal view. And now, of course, she wants something more. Again, this kind of patients ask always more. If I let her, she would come back to my office maybe every 3 months to have another pair of threads. This patient is difficult, not because of her behavior, but because of the previous surgeries and car accident. She has a car accident before, and there are scars on the frontal area, and there is a asymmetry of the eyebrows, as you can see, and she had a previous facelift, and she had a previous frontal lift. So the plan: liposuction first, and this is gliding brow lifts. I combined the gliding brow lift, you know, especially for the upper part of the face, you do Tristan, can you see my slides?
Yes, I can see your slides. I'm on gliding brow lift.
Okay. Yeah, okay. Because somebody told me that they can see the slides. Maybe there's a problem with them.
Okay.
So,
if you have a problem viewing the slides, if you have a problem viewing the slides, the best is to disconnect and connect again.
Okay. Now, gliding brow lift is becoming a popular operation because it's a subcutaneous dissection over the area that you want to lift and plicate the skin and put some stitches over that. Now, I do that. I do this operation, and I also add thread lifts for the brow lift, gliding brow lift, and I like the results. So,
are you moving the slides now? Perfect. I can see them. Sorry.
Yeah.
Perfect.
Yeah. Okay. So I did an asymmetric dissection for the asymmetric eyebrow, for the gliding brow lift, and then for the right side, only eyebrow lift with threads, and for the left side, I did an eyebrow lift and another one to create a Canthopexy look. And I put one more thread for the mid-face lift to augment the mid-face and to have a bichectomy look in order to get rid of the chubby cheeks. And neck lift with threads. This is a week after, and this is 4 months after. Now, I can see the 4 months after from lateral view, from this lateral view, and with a closer look, you can see the bichectomy, the effect of the bichectomy look, the mandible contour, better mandible contour, and a very nice periorbital reshaping, especially the problematic left eye.
Dr. Celik?
And another young patient.
Dr.
Yes.
Celik, before you move on, we have a question. There's a background noise. Where we see you use a lot, it's from Dr. Moll. We see you use a lot of V technique, where you do a temporal incision.
Yes.
Do you use sometimes, let's say Jean-Paul's technique, where he uses the cogs on one side of the thread to lock the system, or do you stick to the V shape?
No. I use both linear technique. I like it a lot, and I use also V technique, especially when I do the things in the operation room. If I, can easily cut the patient and open the temporal area, I prefer to use V technique because, sorry, I'm the doctor, I'm not the company, and threads are not cheap. So when I use with V technique, I can use 2 threads instead of 1 thread actually, and I can suture it to the fascia. It's just like a semi-surgical type of thread lifting, but I still use a lot of threads, as you can see.
Yeah, I can see that.
And I believe that sometimes linear threading is is better than the V technique, because you can use linear technique any part, and the direction of the threads can be adjusted accordingly, adjusted according to the patient's need. But V technique, it's more straightforward. It's mostly for the mid phase, and yeah, for the mid phase, I can use V shape more, I guess, but I use both techniques.
Okay, thank you for your explanation.
Okay, welcome. That is another young patient, and she wants to look energetic. She looks tired, and she doesn't like that. This is, again, the planning. First, liposuction. Actually, it's not liposuction, as I told you before. If there's fat, I remove the fat. But it's the fat, when I'm talking about liposuction for these patients, it's not more than 10 cc. It's sometimes, yeah, okay, let's say not more than 20 cc in a fatty patient. It's 10 cc, 5 cc, but I try to remove some fat all the time. But this patient, she doesn't have fat. But anyway, I undermine the skin with cannula. I'm not trying to aspirate any fat, just undermine the skin. Fat injection to the upper eyelid, or we can see that it's a deep fat injection, and for the mandible contour. And this is the points for the Canthopexy insertion points. And this is threads for Canthopexy. So, as I told you, today I'm not talking about the Canthopexy, but I like to do this kind of operation. Threads are positioned differently than normal when I do Canthopexy. Again, temporal incision, and one thread for the face, another thread for the neck, the other thread from the other side, and I lift the neck, and this is her result. 3 months after the operation, you can still a little bit indentations in both sides of the okay. Gülay Bostos'un
Yes, we can't. We lost the.
Please.
Okay.
Okay. Does it come back, or should
No,
I
I think you should
exit and come back in?
Okay, we can try that. Oh, doesn't the button?
You don't
No,
see anything,
but does
right?
the button share again? Share at the bottom right? Do you have access to sharing your screen, or you have to necessarily get out and come back in? Wait,
Okay.
I think it's back. It's back.
Okay. Okay. Now, okay, Gülay, sorun değil. Now, this is, there are still some small indentations due to Canthopexy, but as you can see, the shape of the eye, but the help of course, fat injection, it's much better. And from the lateral view, the result, and this is the correction of the turkey neck with threads, without any scars. Another young patient, again, the section of the skin for the gliding brow lift, threads for the elevation and lateralization of the eyebrow, liposuction. upper blepharoplasty only only the excision of the skin, simple blepharoplasty, and thread for canthopexy, temporal incision, face thread, another thread for the face and for the lower face and the mandible contour. This is the neck correction with threads, and this is 6 months after the results, 6 months after the operation. A nice cervical-mantle contour with a nice definition of the mandible border. And what about the old patients? They are more difficult. For example, this woman has a sun damaged skin, and the skin should be prepared with laser before the threads. She came to my clinic for thread operation, but I told her that we have to do something with laser, maybe a few sessions. And for that reason, I started doing lasers first, laser treatments first, and this is after 3 sessions of laser treatments. And she says, okay, maybe I don't need threads. I told her that, of course, you need threads. This is before and after with threads, because the neck is not corrected. There's still heavy face. And now the planning. Liposuction, not liposuction. This patient received only skin dissection with cannula. This is the first thread for the mid face. This is the second thread. This is, you can see, this is a different technique. This is to correct the ectropion. This patient had facelift operations more than once. And I want to treat that ectropion with the threads. And this is different. This thread also should be placed a little bit more superficial than usual in order to correct the ectropion. One more thread for the neck. See, this is another different placement of the thread for the neck. Now this time I don't want interlocking, but I want the skin, spread a little bit laterally. So I want to hold this thread and lift it in this way. The fourth thread, this is used to suspend third thread for the neck. So this is our early result, maybe 3 weeks after the surgery, and we should start some more laser treatments in order to correct, in order to make her skin quality better. But because of the corona, we couldn't achieve that. But you can see the correction of the ectropion, and see the face is much better in the neck area, in the face area. Maybe from the lateral part, you can see the correction of the mandible contour. What will happen to the skin? Nothing happens. We can correct that skin with laser. But thanks to corona, we can't do that. Anyway, another old patient, and it's, this is in this patient, I'm trying to push the limits of threads, and she asked me to an operation with threads and not a lot of scars, and I said, okay, let's do that. This is her result. Again, 8 months result. Not perfect because there's no skin excision. only a thread, but not bad as well. It's a medium result, I guess. Another a little bit older patient, and her result, she also received 2 times threads, one a few years ago and then maybe 6 months ago. And she has a much better mandible contour after the operation. You can see the correction of the jaw area and nice mandible contour, and the cheek and the mandible and cheek and the neck is separated with the mandible from the lateral view and from the other part. Another old patient, he also came to my clinic for threads, and I said, okay, let's do that. It's this type of operations that's very difficult to that and doing that in the office. These are the last patients. I operated the last patients in the operation room, not in my office, not in my clinic. And let's see the planning. These parts, all of this is the skin is undermined. Arif, you can see, Arif, girip çıkman lazım. Can you see? Can you hear me, Tristan?
Yes, I can. I can.
Can you see the slides?
Yes, I can see the slides.
Okay, great.
Before you move on, I have a question, if you want, on the previous case.
Arif, bir girip çıkman gerekiyor.
You got the question. You can read the question. You saw the question already?
Which question? Sorry.
Doctor, I might mispronounce this, but Karasian, who's asking
Okay.
how many weeks it usually takes to resolve the skin pits or irregularities that we could see on the previous patient.
Yeah, in all the patients.
Yes.
Especially if I'm pushing with the thread, if I'm trying to solve everything with threads without any skin excision, why didn't I do skin excision in that patient? Let's go back. This patient serve a facelift, right?
Yeah, exactly.
Yeah, I would do that. I would do that. I would remove the skin. Okay, but she had been operated a few times. Not once, not twice. And she's a heavy smoker, heavy drinker, and she likes sun a lot. And she has some other medical problems. They all prevent me doing a long operation under general anesthesia. And she hates the scar. When you say, sorry, I couldn't see the question. Okay, so let's answer the first question. So in this patient, normally, in a healthy patient, in a younger patient, if the skin is something like that, I would remove that skin. But the patient, it's contraindicated. Any surgery, any type of general anesthesia or long surgery or any scar is contraindicated because she doesn't like. So in those cases, I'm trying to solve the problem with the threads. What about the indentations? What about the wrinkles? Will they pass? Of course, they will pass. In a young patient, a small amount, it's it's not more than 1 week or 2. But in those patients, it takes a little bit longer, maybe 3, 6 weeks, 8 weeks, 2 months, whatever. But what's important for me? I have laser. I have laser, and I also help the skin with the laser treatments. So I have the courage to operate this kind of patients with the threads.
So there was another question. I don't know if you've seen it from Dr. Moll. When you say undermine, you really detach the skin, or you just loosen it with your cannula?
Okay, it depends on the area. For example, here in this patient, Now, here in the frontal area, in the nasolabial area, and can you see the scars here? That these are old scars due to acne formation in his young ages. These are scars. I detach everything for this patient, but usually for the neck area, if there's a fat, of course I do liposuction. If there's no fat, I just undermine with the cannula. I really don't detach everything. In some patients, maybe it may be needed, but usually I just, as you said, I just undermine with the cannula, not whole detachment of the skin. But in this patient here, it's a whole detachment of the skin. And fat injection to the area, the infraorbital area, to the nasolabial area, to undermine parts in order to get rid of the scars. Another fat injection, and 2 threads from temporal incision, 1 thread for the eyebrow lift, and this is his result. This is his result before and after, and his result. I also did a few sessions of laser for this patient, because this patient had that kind of wrinkles, especially peri-auricular area, and you can see this is much better now. Another very difficult patient. This old lady underwent facelift before, and she also has some cardiac problems, which prevents her having a long procedure. And she's a difficult patient. She wants everything. She wants everything, and she wants everything without any scar. She wants everything under local or sedation anesthesia, very fast healing. That's difficult to achieve everything, but let's see the stages of my planning. Again, blepharoplasty, liposuction of the neck. First thread, you can see I didn't put the threads in V manner. It's linear threads. Second thread, third thread, fourth thread, fifth thread, and sixth thread for the neck contouring, 6 pairs. And this is after 4 months. After the operation. Not bad. She's happy with the result. But of course, we cannot handle the neck lift, all the neck lift with threads always. This is another patient. I tried with the threads. You can see the early post-op. You can see his result after a few months. It's definitely much better, but it's not enough. So I can see an unhappy patient. It's impossible to correct the neck of this patient with threads alone, especially after heavy weight loss or bariatric surgeries. It's very difficult. The skin is soft, and even if you undermine the skin, even if you put a few threads more than normal, that's very difficult. So I'm lucky because he's a man, and I did just an excision of the neck skin, anterior neck skin. That's a very simple operation, can be performed under local anesthesia. Threads still helps me, especially for the mandible contour, but this sagging skin, I just solved the situation with an excision in the cervical part. So now I'm coming to the end of my presentation. These are the last two patients. I operated them just before the corona outbreak, and this is a patient come to my clinic for augmentation mammoplasty, and I told her that we can do something to her face. Meantime, she said okay. Again, liposuction, a little bit liposuction in the over the mandible too. It should be performed very carefully. A temporal incision, Canthopexy incision, and this is the Canthopexy, and temporal incision, and one thread fixed to the temporal fascia, one more thread for the chin. You will see this is also an interesting type, because this time I didn't send the end of the thread in front of the ear or behind the ear. Instead, I used another thread to suspend the first thread on the neck. And
Nassi. Oh, excuse me.
Yes, I'm here.
You're here. Thierry speaking. Can you go back one slide, please? Yes. Would you please explain precisely the way you put the threads on the Canthopexy? You make first a small incision, very small, very small, to recognize the orbicularis muscle.
Okay, let's see. Okay.
And after, which way you enter, which way you go out?
Okay. This from the lateral orbital part, I put the thread. You can see the middle black part of the thread. So I put the thread here. I cannot put the thread to the canthal ligament. That's impossible.
Yes, I know that.
It's inside the bone. So, but I can give that look. It's a deep placement of the thread, and I bite some periorbicular muscle, and then I choose again. As we talk, in my clinic, I pull the thread in one direction or in another direction to see the best, best shape of the eye. Sometimes it becomes a Canthopexy look, a little bit elevated lateral part of the eye, and sometimes it becomes a little bit more cat's eye, and you'll see the results. Okay, this time also the placement of the threads for the neck is different. Please take a look at the shape of the threads. Again, I first put the thread through the mandible of angle, and I interlocked both threads in the midline, and I put the other end of thread to the neck contour, to the mandible contour, in order to elevate that part of the mandible. It's also a little bit superficial, but this time, before I bury the end of the thread, I put another thread, and I did another interlock, and with this third thread, with the fourth thread, I suspended the neck lift thread. And this is her before and after. from the lateral view, I can see the correction of the jaw area. And the last man before the virus, he came to my clinic for rhinoplasty, and then we decided to go for more liposuction, gliding brow lift, one thread for the eyebrow, and these are the fixation of the glided skin over the periosteum, external sutures, blepharoplasty, a step incision, and removal of fat pads from that small incision, fat injection here and there to the chin and mandible contour in front of the marionette line and some cheek, one thread for the face, another one for the neck, fixation of the threads, one more thread for the neck, and they interlock each other, and this time I lifted the neck thread in a preauricular vector, and finally I did what he wanted, a rhinoplasty, a preservation rhinoplasty for him. This is his result. See, with threads, it's okay. You can make a patient younger, and you can make him look more handsome or more beautiful. This is the end of after, I don't know, a little bit more than 1 month. This is before and after oblique view. And voilà, merci beaucoup pour votre attention. Is there any questions?
Thank you very much. I think now, thank you very much for this nice presentation. I think we managed to go through, even with the connection issues. So maybe now we can open for live questions rather than through the chat. So just feel free to speak through the microphone so Dr. Celik can answer directly.
Mustafa, I don't know. Let's see. How can I?
On peut plus activer les micros.
Ah bah si, on t'entend, Thierry. On t'entend, Thierry, là.
Okay.
Okay. No.
So to ask a question, you need to unfreeze your microphone. We can't do it. You're the only ones to be able to do it. So please unfreeze your microphone before you speak.
First of all, I want to really congratulate Nassi, because he's thinking a lot. He's not a bullshit surgeon. He's thinking and learning a lot of things. But have a lot of questions, of course.
Of course.
Of course. And maybe Bernard Cornet has questions too. Bernard Moll too. Well, about your undermining of the neck? I know is essentially is to make the skin move and maybe retract afterwards.
Exactly.
So you accept to have a very thin, a very superficial anchoring of the thread with the curious result immediately after surgery. You accept that because you have been undermined before.
Yes. And because I undermine the skin, I have to put the thread more superficial than I do in the face. So the thread will spread the skin. That's what we want, actually. Many people would think that we don't necessarily need the threads there. We can do just liposuction. No, it's not. Then you will see irregularities due to liposuction in the neck area if you do only liposuction without threads. But when you do the threads, I don't see that kind of irregularities. Of course, if I don't push the limits.
Dr. Celik, I think
Yes.
you may turn off the presentation, maybe. That will maybe help. I don't know if you've turned it off already, but there's a...
Yeah, I closed the presentation.
And you're not presenting anymore? Okay, it's fine. I think it should be better now.
Okay. Let me see the questions. No.
You have a question from Dr. Goglu. Sorry.
Murat Tapalan, thank you, sir. Tahsin Görgülü asks me, what is the tip of temporal fixation? I don't know, what do you mean by the tip? And what is the combination timing of both use of threads and fillers? Okay, the combination of the thread and filler, I usually do fillers first and do threads next. But sometimes it depends on the patient. Sometimes, and it depends on the the result of the patient. I always preserve some more filler at the end of the operation so that I can correct some problems.
Nassim, I have
Yes.
a question for you. When you put your main vertical thread from the temporal area up
Yes.
down to the mandibular, and you like to go around the mandibular very, very down, do you need
Yes.
a longer thread that we have?
Yes, of course. Yes, of course, at least. And in some patients, that's very difficult to finish that maneuver, especially if they have big guys, long faces. But in most of the female patients, it's not a big problem. And how can I overcome this problem? I should put the thread a little bit lower than actually I should put. So, but it's better. That's for Jean-Paul. I want many of the surgeons or practitioners who do the threads. We all want a few more centimeters longer threads.
Yes. Okay. Tristan, you will produce more.
Yes.
Yeah.
Yes, we've already had this comment from Dr. Celik where we're looking into it, but it's not that easy. It takes time to develop. So we're definitely looking into it, but let's get out of the corona first, and then we'll see how we can work on that.
And for the tail of the eyebrow that we need, any surgeon needs to elevate the tail of the eyebrow, you know that. So you, like the Canthopexy, you do a small incision in the hair or not? You do a small incision in the eyebrow and you put your black things in the hair of the eyebrow, or you put two straight vertical threads without a V,
Okay, I understand. I do
describe
both.
the way you elevate the tail of the eyebrow, please.
Okay, actually, I don't want to call it eyebrow elevation. It's more pull of eyebrow laterally. I don't want to elevate in a superior movement. I do it more laterally, and for that it depends on the position of the eyebrow of the patient and the thickness of the eyebrow. If it's a thick eyebrow, it's better for me, of course. How I do that usually, I start from the scalp, from one incision, and I put the thread from there and send the thread in the direction of the eyebrow, and I take it the thread out of the eyebrow, not how to say, not at the edge, but a little bit, maybe a few millimeters medial to the end of the eyebrow. And then I put the thread back again from the same exit point and make a turn. And this time, this turn should be not a wide, U-turn. It should be a narrow U-turn in order not to pinch the eyebrow. And then I would send the thread back to scalp. So this way, especially if you have enough tissue, and you can fix the eyebrow. And if patient needs definitely a good eyebrow lift, I always nowadays include gliding subcutaneous lift to my eyebrow lifts. I think it's a very nice solution for the temporal lift, with the subcutaneous lift, with the help of the thread. But young patients ask for just eyebrow lift. I can do that under local anesthesia in my clinic. Just this small U-turn, similar to Canthopexy, but there are differences. But I don't know how to explain them. You have to come to my clinic. I'm very happy to accept anybody.
I have a last question, because I'm very interested by your history. 5 years ago, you were practicing a lot of facelift, surgical facelift, or more, because when did you know the thread? When did you make the threads? In which year? Which year?
It's the beginning of 2016, I guess. 4 years now.
16.
For more than 4 years.
Okay.
Until
and
2016.
And before this year, you were doing only surgery.
Yeah. Okay. Before that, I was one of the
most famous.
I was very against use of threads, and I had a lot of YouTube movies, and in my website I said threads are bad, don't go for threads, don't do anything. Because why? Because I tried threads in maybe 2002, 2003, and not with silicone threads, with temporary threads and proline threads, and I faced with a lot of problems. Patients, yeah, some results were good, but the results didn't last longer than 6 months, and if the patient is lucky, sometimes it's not even 4 months, and because threads are even that time they were expensive. So I said, okay, what I'm doing, it's an easy operation, but at the end of the day, patient is not happy with the result because it doesn't last for a long time. So I don't like the threads. And so you told me that you have a lot of facelift patients. No, actually, I didn't have a lot of facelift patients. In spite of, despite I don't use threads before 2016, I didn't have a lot of facelift operations. Why? Because patients are afraid of having facelift. That's an expensive procedure. And, yeah, of course, I've done a lot of facelifts, but in every facelift, the day after the surgery, when I go to hospital and to check the patient, I was praying inside and said, okay, let's see a perfect symmetric face, not a dropped mouth, not a dropped eyebrow, because you can see that all the time in the facelift. But when I was introduced with the silicone threads, of course, like anybody, I tried that with my relatives first, and then even after the first thread operation at that time, back to 2016, I said, okay, now this is different. Now, first of all, this is something I knew. This is silicone, and silicone, everybody knows silicone. It's a very good material. Second, it's permanent. Third, I can remove the silicone. That's very important. If the patient is unhappy, okay, no problem. Give her money back and remove the silicone. No, first remove the silicone and then give her money back. Why not? Why did I lose 300 euros, 400 euros? No, yes, of course, I lost 300 euros, 400 euros, but I learned something. I learned how to choose the patient, how to choose the right patient. And it's very easy after, after a few operations. So the most important thing, if you do something wrong with the facelift, okay, that's sometimes you cannot undo that. You cannot undo a nerve cut in the facelift. But the threads may get infected. Okay, just remove. Thread goes very superficial and you see dimples. Okay, just remove it. And next time you learn how to use it in a perfect manner. That's what I like with the threads. And facelift. Okay, facelift is a technically demanding operation. Yes, it's not an easy operation, especially for young people. And you have to be very experienced with the facelift. But it is a straightforward operation. You cannot play around the facelift. There are some techniques, of course, subcutaneous technique or SMAS techniques, high SMAS techniques, whatever. But when you read the book, you do that with the technique. Not sometimes you cannot adjust the technique according to patient's need. But with threads, okay, threads is in your hand and face is in your hand, and you do whatever you want. Try one thing, try another thing, put another thread, put one more thread. Let's wait for a few weeks and put another time. Why not? That's the beauty of the thread. And even facelift patients now, I do facelift. It's more, as I told you, and I do it cheaper than threads. And even that facelift patients, I correct. I sometimes use threads during the facelift, so it's it's a magic facelift, like 2 hours facelift, not a usual 4 or 5 hours facelift. But after a few months, I put one more thread here, one more thread there, and I finalize the result with threads, and patients are even happier. So thread is a must for the plastic surgeons.
Yes.
Nassi, hello, it's Jean-Paul.
Hey, my friends. How are you?
Thank you very much. We come to see you in Istanbul with Thierry 3 months or 4 months ago. And since I come back in France, I use your technique, your procedure for the neck. And I think it's very clever. Your interloop, the 2 threads with your interloop is very. I have big result. You speak about sorry for my bad English. You speak about to put the thread very superficial.
Yes.
And I think it's really right. And now I think the result of the neck are as well as good as for the face. Before I was afraid
and
to.
do you do skin dissection with liposuction or without?
No, I don't do. I use only genital loop without liposuction, and the result is very good. Perhaps in the future, I use also liposuction, but now I have 4 cases. It's not a lot, but the four women are really happy. So thank you very much.
Okay. You're welcome. I've learned a lot from you. So,
Dr. Celik, we have another question from Dr. Angelbert. So I'll translate it. It's in French. So the
okay.
thread that,
Okay.
You can see it, or you want me to?
Tristan, tu peux peut-être traduire?
Oui, c'est ce que j'allais faire, mais je pense que Dr. Celik est en train de lire la question. Je pense qu'il est en train de. If you want me to translate it.
Okay, please.
Okay. So the thread that is used to maintain the mandibular angle and correct the mandibular ridge or the neck, doesn't it enter in conflict with the temporal or auriculotemporal nerve of the V3? Should it be more superficial to avoid such conflict?
Okay. Yeah.
Où est-ce que tu la vois, la question?
Il faut que vous remontiez.
Ah oui, d'accord.
Il y en a eu plusieurs.
Il y en a une autre.
Il y en a 3. There's 3 questions, but let's start by the.
Two questions. First, yes, it's superficial, and I don't see that kind of problems until now, and I hope I don't see that. And second is just like Jean-Paul's technique, like the mastoids. Yes, I can do that, but as I told you, it depends on the patient. When I first put the thread from the mandible angle, I pull the thread in one direction and in another direction to see the result on the neck. And sometimes I don't like the results from the back or from the anterior part of the auricle. I don't like both results. Then I put the thread back and I hold this thread with another thread. As I showed you in the last patient. But yes, I use both of them. I use both mastoid part and preauricular part.
Okay, thank you. So there's another question from Dr. Angelbert as well at the bottom. So the thread used to open the look by lifting the tip of the eyebrow. The middle part is in the scalp. It starts by going down towards the eyebrow, then goes back up to end in a more external position. Does this going back up at the tip of the thread, doesn't it push the dermis down or the subcutaneous tissues downwards?
Yes, it may do that. So you have to be a little bit deeper. And sometimes at the end, especially near the exit points of the, for example, eyebrow or canthal part, I see small dimples. So what is the solution? That's very easy. I just do a small amount of hyaluronic acid a few weeks later, a few weeks after the operation. But the first thing, especially in the upper part, I don't pull the threads a lot. The thread should be in the best position, which keeps the eyebrow or the canthus of the patient in its position when she's or he is lying down. So I don't pull the threads in the upper face. In the lower face, no problem. I will give a little bit more lift to the thread no problem with that. And in the face, in the middle part, it's in between. Not too much power is exerted on the lift part of the thread. And overcorrection is should not be done in the superior part because it will cause dimples, as you said. And because the subcutaneous tissue is not too thick there, you should be very careful not to exaggerate a lot of power on the threads. But you can see the dimples, and then you have to do a small amount of hyaluronic acid for after a few weeks.
Okay, so you're receiving a lot of congratulations for your presentation.
Yeah, thank you.
So maybe we have a bit more time for a few questions because we're a bit late because of the connection. Maybe we have time for 1 or 2 extra questions, if that's okay with you, Dr. Celik.
Okay, let me see if there's any question that we didn't.
If you want to ask a question, you can unfreeze your microphone and ask Dr. Celik directly, as Jean-Paul and Thierry just did.
Mon doux Bernard, tu n'as pas une petite question? Ah, son micro marche pas.
Ah.
Bernard Cornette.
Attends.
Je le vois s'agiter avec son magnifique t-shirt.
Attendez. Bernard, vous m'entendez?
Non.
En bas de l'écran, si vous m'entendez, en bas de l'écran, au milieu, il y a le microphone. Il faut le passer en blanc. Là, il doit être en rouge. Il faut cliquer dessus pour le passer en blanc. Si vous souhaitez poser votre question.
En bas de l'écran.
C'est bon là?
Ah.
C'est bon. Yes, I'm very impressed by your all your results, but your Canthopexy is very original. But a question, please. Do you enter the threads from the canthus here to the back, or do you enter from the head and come back to the head? Come back to the head after a loop, you turn, please. I did not understand
from
how
the
you perform.
canthus. Yeah, from the canthus. I put the threads from the canthus and I exit in a V-shaped manner from the scalp. And I do just a small amount of pull in the scalp part of the threads.
So excuse me, you see me? You enter here in
Yes.
the canthus, you go with the needle here,
Yes.
and
Yes.
the other needle here?
Yes.
Oui, Bernard.
Yes, but when you pull, it goes down,
No.
you pull the threads,
No.
and it goes down, it doesn't go up. That I don't understand.
No, it doesn't go down.
When I go I pull like that and I push up the face. But if you enter from the low, it goes down. So I don't understand, please.
Yeah, it doesn't go down.
Okay. Because
Yes, Natty, you tell us that the black point were in the canthus. Was in the canthus. So Bernard is right.
Yeah, near the canthus.
It's right. When it's difficult to understand.
Je vais t'expliquer, Bernard, si tu veux bien. En fait, il n'y a pas de remise en tension de la peau à partir du sourcil. C'est simplement la boucle qui accroche le bord de l'orbiculaire et l'accrochage se fait dans le cuir chevelu. On n'a pas de remontée effectivement de la peau là. C'est juste un accrochage terminal au niveau du canthus externe. Il n'y a pas de remontée de tension de la peau sur la longueur puisque les crans effectivement sont dans l'autre sens et vont servir
voilà,
à
c'est ça, c'est l'écran dans l'autre
dans le
sens.
cuir chevelu.
Je ne comprenais pas.
Voilà.
D'accord. Donc on part de là, on fait un V, quoi. Et puis après,
l'autre solution, c'est effectivement de rentrer par le cuir chevelu au niveau de la tempe, de venir sortir au niveau du canthus externe. Alors, soit de dresser le fil en linéaire, soit de lui faire une petite boucle comme il fait au niveau du cou pour avoir un meilleur verrouillage et un anti-retour.
D'accord.
Yeah, but
D'accord.
you can do that, but in the counters, I don't do that maneuver anymore because I don't want to pull a lot at that part. You will see once you do that, but this way, starting from the canthus and sending the both threads to the skull, you will see just a small amount of tension of threads will be enough, especially if you do gliding broad lift and you include the Canthopexy with the gliding broad lift. It means that scarless temporal lift. It's perfect. It's perfect, but you don't need that.
Ok.
Jean-Paul, est-ce que je suis d'accord avec Bernard? Tu m'entends?
Oui, oui, très bien.
Oui, je voulais juste te poser cette question. Finalement, quand on part du canthus pour aller vers la tempe, on n'a pas besoin de cran.
On n'a pas besoin de...
De cran.
Ben, le
Thierry,
problème, c'est après la répartition.
Thierry,
Ça dépend de l'âge. Après,
vous pourriez
de
poser
répartition.
la question en anglais? Parce qu'on a encore des
Anglophone.
médecins turcs, des anglophones avec nous, pour qu'ils puissent suivre. Merci.
The question, oh, it's very difficult because je vais passer pour un imbécile. Mais je suis d'accord avec Bernard.
Okay. Pardon.
What is the use of the cogs? What are the use of the cogs for the Canthopexy when you enter through the canthus up to the temple area? What the use of the cogs? The retention. You need not any retention.
Yeah, the cogs are there, and even the direction seems not right. They hold that, how to say, thin skin. We don't need a lot of power of the threads in the canthus area. Just a small amount. We are talking about 1 millimeter.
Et comment tu les fixes, les fils? Jean-Paul.
Ben, il y a deux façons de les fixer. Soit effectivement, on fait une boucle au bout et on sert d'un petit verrou avec le retour du fil qui repart dans la même direction. Soit on les met sous forme de V à partir du canthus externe. Mais à ce moment-là, tu n'as pas de tension de la peau. Et si tu veux avoir une tension de la peau, eh ben, il faut faire en pose droite, entre guillemets. Tu rentres par la tempe et tu vas sortir, comme on l'avait fait au niveau du canthus externe, sous le canthus externe, au niveau de la paupière inférieure.
Voilà. Et c'est la question.
Mais le retour est peut-être intelligent, le retour est peut-être astucieux parce qu'il améliore la certitude, il garantit la certitude de l'accrochage de la partie terminale près du canthus externe. Si tu peux traduire, Tristan, pour tout le monde.
Moi, tu peux. Faut que tu me réinterprètes ça.
Oui. Alors, Nathy, could we imagine to put very simply two normal threads? We enter by the temple and we go out on the canthus.
Yes.
With two separate threads. Like that, you have a retention fixation in the scalp and an elevation on the skin of the temple.
Yes.
It is the way we use since few months.
C'était pas clair ce que j'ai dit, mais.
Yeah, I understand. What do you mean?
Ah, bravo.
Yeah. And you have to send me some free threads. It's 2 threads. I'm using 1 thread.
Okay, thank you.
It's expensive. But yes, I can do that. But the problem is, I want to, especially in the canthus area, I want to lift a small amount, and I want it. I want the thread not to slip even 1 millimeter. So I have to make a loop. I could do
You don't have
What about dimple, you say?
You don't have dimple, Nasi, in the extern canthus extern?
External.
Yes, I can see dimples, but when I see a dimple, I'm sure if I'm deep enough, I don't see a lot of dimples. And just after the placement of the thread, I do a dissection in the exit point in the canthus area in order to spread the, the skin.
But you catch the skin or the muscle?
Sorry?
You catch the skin or the muscle? Or the
I pull the muscle, but I dissect the skin over the muscle. And
to avoid dimple, yes.
Yes, if I still see a dimple after 2 weeks or something, because patients start to talk, I see that dimple, I see those dimple, whatever, then I do a small amount of hyaluronic acid injection there. And that's all. That resolves. And okay, what happens after the hyaluronic acid goes? I don't know. Nothing happens. The dimple doesn't come back.
Mm-hmm.
But I can do that like I do in the eyebrow lift. I mean, starting from the temple, I can go to the canthal area and make a U-turn and go back to the scalp again, and I can pull the thread. Yes, I can also do that, but it's a very difficult maneuver, and I'm at that time I cannot be as deep as I want to be, like in the first method. I cannot make the turn. If I'm doing surgery to the patient, like a blepharoplasty, lower blepharoplasty, or upper blepharoplasty, yeah, okay, it's easy. I see everything. But in closed operations without blepharoplasty, I prefer to put the thread from the canthus area. In the eyebrow, no, I'm starting, like you said, from scalp and make a U-turn in the brow area. I can do that easily, but for the canthal part, it's a very difficult maneuver for me to do. And see, I'm doing that under local anesthesia, and I don't want to, disturb the patient a lot with trying to turn the end of the thread near her eye. So it seems easier for me.
Okay. I think maybe we can get a last question, if that's okay for you, and then we can give it a call if it's okay with you, Dr. Celik.
What is your average of surgery now? Your amount, your average thread and surgery and facelift compared to 4 years ago, compared to 4 years ago?
For now, at the moment,
yes,
0. We are in lockdown.
0 surgery?
No, because of Corona.
0 nothing. Because of Corona. Okay. Okay. It's, of course, I'm doing more threads. I'm doing more threads because, you usually you cannot combine the facelift with another surgery. Yes, you can, but it takes time. I work alone. I don't use any nurse with me. I don't use another doctor with me. I work alone, so I cannot combine the facelift with other operations like breast lift, like rhinoplasty. It takes forever then. But for this reason, for every combination operation, like facial rejuvenation plus rhino, facial rejuvenation plus breast, facial rejuvenation plus whatever, we always use threads. So the amount of threads is much higher for me. It's maybe, let's say, in 10 operations, it's 8 with threads, maybe 9 with threads.
Last question. Do you hear me?
Yes.
Yes. When you undermine the temporal area with your cannula, do you risk to hurt the temporal nerve?
No.
Why?
Because I'm totally under the skin. It should be very superficial,
okay.
and under the skin, nothing.
Good question and good
there.
answer. Yes, very not deep, very under the dermis. Under the dermis.
Yeah, I can see the shadow of the cannula.
Okay, that's
okay. I do a lot of local injection, and I do totally superficial. And in this area, in temporal part for the gliding lift, I release everything. I design a device for that. I design a cannula, something for that, and I release everything, and it's no fear. And depends on the patient, I can do this undermining down to cheek, no problem. Just under the skin, there's nothing.
And do you do the net of you know? I don't remember Bauer Sachs or the surgery with a net of a lot of stitches here.
Yes.
Do you do that?
Yes, of course.
You like
and
that?
I remove that stitch. Sorry?
You like that, this net of stitches to a lot of...
Yes, I like that.
Yes, okay.
Yes, I like that. The last patient was an example for that.
Yes, okay.
And I removed the stitch in 2 days. And I always, normally it's not in the usual usage, I always include threads when I do net. For the neck, for the eyebrow, for anything.
Yes, okay. Okay, thank you.
That's a good
You're welcome.
Is there maybe a last question before we give a conclusion? Or we just end the webinar?
C'était vraiment très bien, hein, ce webinaire. Super, merci. Je suis très content.
Eh bien, merci.
J'ai appris beaucoup de choses. I learn a lot from you.
Thank you.
Very good, very nice.
Merci beaucoup, docteur.
I did not understand 100%, but
Oui.
I will work with Jean-Paul to perform to increase my knowledge. Thank you.
We will send you a record of the webinar in the next days, so you'll be able to have the explanations and the video and the slides again.
Okay, I'm so happy. Thank you.
You're welcome.
Bye, Bernard.
Okay, so I think I wanted to thank you, Dr. Celik, for this presentation and having challenged the technical issues we faced. I think we did a great job, and I think you have a lot of congratulations. So that's
thank you.
Very good. So thank you very much. And as I said, we will send everybody the record of this webinar. And that's it. Thank you very much, everybody, for attending and having stayed with us.
Thank you. Bye.
Bye-bye. Thank you.
Thank you very much, Dr. Celik. Thank you so much.
Thank you.